You get out what you put in. So I think trying to go the extra mile to actually tangibly help someone's quality of life was really important to me.
One thing kept coming up again and again in the idea of the future of medicine is shaped not only by accomplishment, but also by character. And at UT Southwestern, there's a very special honor that recognizes one graduating student, not simply for their academic standing, but for embodying medical wisdom, human understanding, and compassion for the patients they serve. That honor is called the Hodin Award. What would it mean to you if you were to be honored with this award?
I think feeling very humbled. I just felt like goosebumps go down my arms.
Welcome to Learning from Leaders, a podcast from Southwestern Medical Foundation where we dive into a world of wisdom, mentorship, and innovation, exploring the insights and life lessons of seasoned community and business leaders. I'm Michael McMahon, President and CEO of Southwestern Medical Foundation. I invite you to subscribe now and join us on this empowering journey of growth and leadership. Now, let's learn from the best and drive meaningful change together.
Welcome to Learning from Leaders. I'm Dustin McGuire, a longtime producer and first-time host of the podcast. We're kicking off a special Future Leaders series, and today we have the privilege of being joined by our first future leader, Hannah Chang, a medical student at UT Southwestern, class of 2026, whose journey already reflects the kind of thoughtful, service-driven leadership we see in so many of the medical field's best physicians. Hannah, thank you for being here.
Glad to be here. Thank you for having me.
Of course. Before we get started, I just want to highlight a few of your accolades to give the audience a little bit of background on our conversation. You graduated summa cum laude with a degree in economics from the University of Pennsylvania. You maintained a 4.0 GPA at UT Southwestern, authored or co-authored 15 peer-reviewed publications, contributed to more than 25 oral and poster presentations. You were named a fellow for the Pediatric Dermatology Research Alliance, volunteered in the Agape Free Clinic, and supported patients facing homelessness and other life challenges through volunteer work in the Patient Navigator Program, which earned you the UT Southwestern Presidential Volunteer Service Award 2 years in a row. I could keep going, but we'd run out of time. That's a lot of accomplishments in a short amount of time. You recently celebrated Match Day, where you matched with Sanford Healthcare. By the time the episode airs, you will actually be Dr. Hannah Chang. Tell us what that moment in your life is going to mean to you.
Yeah, I would say it still feels really surreal. I think it's the culmination of all these years of hard work. I've dreamed of becoming a pediatric dermatologist since I was a sophomore in college. So I think this is kind of the next step in being one step closer to fulfilling that dream. And I think it also goes to show just how great the community I have around me is. All of the family, friends, even, the maintenance workers, the shuttle drivers on campus who kind of support me each step of the way. I'm really grateful.
So take us back to Match Day. Tell us a little bit about the process to kind of give our audience an idea of the kind of nerves and the build-up to Match Day, because it's kind of a nationwide kind of celebration of physicians taking that next step in their career.
Sure. So as fourth-year medical students, we submit applications in September, and then we go through interviews between October and late January usually. And then we create these ranking lists where we rank each program we interviewed at in order of our preference of where we'd like to go. And then each program also ranks all of its applicants that it interviews. And then this giant algorithm, I guess, just pairs, applicants with programs based on its applicant favoring. So, if a program really wants you, but you didn't rank them high enough, you will probably end up somewhere where you would like instead. And then Match Day is where we find out where we matched.
So you kind of have an idea of where you might end up. Is that the case?
Well, it could be anywhere I interviewed.
Okay.
So I truly did not know. I interviewed pretty broadly, which was a little nerve-wracking, geographically at least. West Coast, East Coast, Midwest, Texas, everywhere. So I think the most nerve-wracking part was not knowing where I would be in 4 years.
That's why, yeah, one of the things just thinking through the logistics of it is you don't know where you're going to be living for the next several years of your lives, and it could be across the country. And how do you prepare for that? You just able to compartmentalize it?
Yeah, I think one advice I received was to think about one positive thing about every program that I interviewed at. That way, when you open the envelope on Match Day, if it's not your top choice, then at least you're still incredibly grateful. And I'm super lucky that I matched to both of my top choices for my intern year and my dermatology residency. But I went and prepared that, wherever I ended up, I'd be really happy. So
you are staying in Texas for 1 year. Kind of explain, is that for all specialties or is that just dermatology, or how does that work?
Yeah, so it's not just dermatology. It's, I think, dermatology, radiology, PM&R, and some anesthesiology specialties. They require 1 year of just general medicine. And I think it's because for dermatology, at least, skin disease often isn't just skin deep. It can be manifestations of things that are happening internally. And so it's really important to have a solid foundation in general medicine before starting dermatology. And so that's why all people who are going into dermatology have to do 1 year of just general medicine. And it can be in, surgery, internal medicine, pediatrics even. It's pretty open.
So could you have gotten a different transitional year location, or are you happy with the kind of how it worked out where you're going to be here for a year and then you're moving out?
Yeah, so my husband actually works in Fort Worth, which is why we prioritize staying, in DFW and wanted to be in Fort Worth. But you can go anywhere. Like I interviewed, in Wisconsin and North Carolina. It usually leads to you having to move twice, but you can really go anywhere.
Okay, so after you walk across the stage and you become Dr. Hannah Chang, you will transition from a student to someone that patients now look at for critical answers in their healthcare journeys and their healthcare needs. You've already put yourself into a position to gain some of that patient-facing experience in some of your volunteer work. But when you put doctor in front of your name, does it carry more weight when you go into a clinic or a healthcare environment?
Absolutely. I think there's a lot more responsibility, and, you have to do the right thing for each patient all the time, which everyone should be doing, all the time anyway. But I think there's just greater responsibility in the fact that, you're the one putting in orders for patients rather than just, as medical students, we can pen them and they're later signed by a physician. But, as a resident, we'll be the ones actually ordering things and kind of being the patient's first line of care.
How's your training at UT Southwestern kind of prepared Hannah to become Dr. Chang?
I'm so grateful to UT Southwestern. I think the clinical training is just phenomenal. We have so many diverse sites that, doesn't always happen in other institutions. We have Clements, a private hospital. We have Parkland, where I probably learned the most from patients there. And then we also have the VA. And so I think just that the diverse training sites has been phenomenal. And then research opportunities have been, huge. We have 6 Nobel laureates here. So the research environment is very productive. And even just support from all the way from the highest, like the deans, all the way down to, the shuttle drivers. Everyone has been really amazing here, and I'm really grateful.
So what initially drew you to UT Southwestern? Did you apply at other places, or was there a specific thing that kind of pushed you in the direction of UT Southwestern?
Yeah, so I went out of state for college. I was in Philadelphia, and I just really wanted to be closer to home. And so I applied pretty broadly, but I wanted to go to a school within Texas that was very well known and would set me up for later success. And I've wanted to do pediatric dermatology since I was a sophomore in college. And people say don't pick a medical school based on your future specialty because you could change your mind. But I kind of did do that. And UT Southwestern is a top 10 program in the U.S. for dermatology, and so that was why I was drawn to it as well.
Do you feel more confident knowing that you've graduated and you're a doctor, or do you feel a sense of vulnerability as you're kind of starting this new process in your life, even though you've got this title and these accolades? What's the kind of balance of confidence versus vulnerability moving into this next phase of your life?
Yeah, I would say I feel both. I think primarily I just feel excited to learn from and with colleagues and mentors who are just excited to teach. So I think excitement is probably the biggest word I would use to describe how I'm feeling right now. A little daunting to have to learn all of the information. People say that medical school just sets a foundation and you're nowhere near ready to be a full-fledged doctor by the time you graduate medical school. You learn most of your, hands-on knowledge in residency. And so it's a lot of learning, but I'm very excited.
Learning from Leaders, along with Southwestern Medical Foundation, is powered by generosity. Your support can help fuel breakthroughs in medical research, provide critical patient care, and support medical education. Additionally, it helps support the Learning from Leaders podcast and content like this. Every gift matters. Consider making a contribution today at swmedical.org/give. That's swmedical.org/give.
What kind of responsibilities come with now being seen as someone that younger students may start to look up to as you move into this residency phase of your career?
Yeah, I think there's a big responsibility of giving back. I think, just last week I was hosting a 1-hour drop-in session where, MS1s and first and second year medical students could, just drop by and ask questions about applying to dermatology or just life in general. And I think I've received so much incredible mentorship from upperclassmen as well as, physicians. And I think there's an incredible duty to pass it forward.
So do you see yourself kind of taking on that role as a mentor? Are you fulfilled a lot by that?
I do. I'd love to stay in academics and, be able to do research, have clinical training, and then mentor kind of the next generation, especially in pediatric dermatology when, the community is really small and there's difficulties with retention in the field because it's an extra year of training after dermatology. And people usually don't want to spend that extra year. So I think, I think early exposure to the field is one of the greatest predictors of later success. So I'd love to expose people to the field at a younger age.
Do you have any specific mentors that you've leaned on when you kind of look back at your time as a student, that you're kind of taking those same teachings and kind of taking that in forward as a mentor yourself?
Yeah, absolutely. There's honestly so many. Four come to my head immediately. Dr. Joy Wan, I met her when I was an undergraduate at Penn, and she was my mentor at the Children's Hospital of Philadelphia. She, let me follow her to Johns Hopkins when she moved there a few years later. And so I spent a summer with her doing research, and she was incredibly helpful. And then here at UT Southwestern, Dr. Melissa Moskar in dermatology, she introduced me to the field of vulvar dermatology, which is something I kind of hope to go into. And then, but at the end of the day, I told her I still want to do pediatric dermatology. And so she connected me with two other mentors, Drs. Shayla Admani and Kalyani Marate, who do pediatric vulvar dermatology. And so all four of them have been incredibly helpful in giving me advice and, supporting me every step of the way.
Is there any specific lessons that you hope to carry forward that you've learned from them and kind of pass on to younger students as you mentor?
A lot of dermatologists are pulled in so many different directions at once. There's caring for patients, doing research, trying to, squeeze in some mentorship to people. And I think, and a lot of them are moms as well. And so I think they've taught me a lot about how to balance it all at once and, learn, how to say no to certain things when you don't have time for them and not going over your limit. But I've learned a lot about, just balance in general and how to be like a girl boss, I would say, but still maintain quality of life.
Explain vulvar, if I'm saying it correctly, vulvar dermatology. What is that, and what does that mean?
So it's pretty much women's health. So it cares for, the vulva, skin issues that can arise. One of the most common is lichen sclerosis, which primarily affects, either pre-adult or pre-pubertal girls or postmenopausal women, just due to the low estrogen states in these populations. And so I think there's just so much stigma around women's issues sometimes. And so what Dr. Moskar and some of these mentors are trying to do is just to bring more awareness. And a lot of times when patients come in to see them, patients will say I was too embarrassed to bring it up earlier. And a lot of times they come in with pretty severe disease. And so I think just raising awareness for the issue and that it's not something to be ashamed of is something that, my mentors are doing. And I'm really proud of them for doing that.
That's excellent. Do you want to encourage more dermatologists to get into that field as well?
Yeah, so there's not many dermatologists who specialize in it, and especially pediatric vulvar dermatologists, they're like unicorns, in the field of dermatology. There's even fewer of them. And so just being able to, I think, raise awareness that this is, an issue and that we need more specialists. So I do hope to go into it.
Let's talk a little bit about your service. How has service helped shape your understanding of leadership, especially through your work at the Agape Dermatology Free Clinic that we mentioned earlier and the Patient Navigator program?
Yeah, I think something I've learned through medical school is that leadership doesn't mean, the person who speaks the most or is, maybe the most present in every single situation. I think I really believe in leadership in terms of, doing the right thing or getting things done and getting things done correctly. So I'm not always the loudest person in the room, but I think that, by setting a good example to patients as well as, colleagues, treating every patient like you would your own family member, things like that, those all count as leadership.
What kind of skills and leadership in terms of patient relationships did you learn in those programs, working in those clinics, in those settings?
I learned how to meet people where they are and work with people from different backgrounds. My father, I derive a lot of inspiration from him. He grew up pretty underserved. And so growing up, he was always saying, always give back to people who could use more than us. And so, through the Patient Navigator program, for example, I met weekly with, a patient, Mr. H, we'll call him. It's really, we just helped them get back on their feet. So I helped him, do things like apply for a driver's license that he'd lost. That was probably one of the proudest moments in medical school that I had. And so I think examples like this or volunteering opportunities, a lot of students, you get out what you put in. So I think trying to go the extra mile to actually tangibly help someone's quality of life was really important to me.
And that's something that totally unmedical related.
Right.
Yeah. So
it's really just
that's amazing.
Google.
Yeah. Also, you volunteer in a musical group during your time as a student. Can you tell us a little bit more about the UT Southwestern Heartstrings Ensemble and what is your role in that and what is the goal of it? What do you hope to provide to patients through that?
Sure. So I started playing violin when I was 5 years old. And so coming into medical school, I wanted to continue. The Heartstrings Ensemble is, it's duets, trios, quartets that meet, once or twice a month. And there's usually a sign-up sheet so you can sign up whenever you want to play. And we visit the Clemens Inpatient Psychiatric Unit to play for patients who are, there. And it's really a great experience because afterwards you can kind of talk with the patients. And sometimes when you're playing, you'll just see them like close their eyes and kind of like sway back and forth to music. And it's very calming for them. And so I think it's a nice way to, connect with people. And music is a very universal language. And so I really enjoy doing it.
And we see so much that combination of art and medicine, and that's kind of an extension of this. So, I mean, do you feel like it really benefits them, maybe not medically, but holistically?
Yeah, absolutely. And I think music and medicine aren't so different, just as like people in medicine like work together. We have social work, nurses, dietitians work together to create the best patient care possible. I think musicians similarly, everyone plays a different instrument like violin, viola, cello. We even have some like wind and brass instruments as well, but everyone comes together to create something that no one could do alone. And so I think there's a lot of similarities between the fields.
Working in those groups and everybody having a part, how does that kind of help shape how you view your role as a leader in medicine and like working with different teams?
I think it's taught me the nuances in teamwork, in music at least, whenever groups are the most, I would say, in sync and performing well together is when you're like, making eye contact when you're playing a little bit and cueing and taking in these like small details that otherwise might go unnoticed. And I think it's similar in medicine, going the extra mile for each patient and noticing the small things. Like, on my rotations, I would try to bring a patient's like little side table closer to them if it was out of reach, or just trying to be like in tune to what each patient needs, as well as with other team members. So I think there's a lot of similarities.
Helps with you being very observant. You've already started to focus a little bit on research. Is this something that you want to focus more on as you move forward, or do you want to, how are you going to balance your time between kind of research and clinical care? What do you have more passion for?
Yeah, I definitely want to continue research. I think, it's not something that people just like check off their list of things to do. I really enjoy doing it. I think that to advance patient care long term, you need research and need new data and new ideas. So I definitely want to continue it. That being said, I do want to continue seeing patients. So I don't think I mentioned this, but I was actually in engineering in college. I started off there and enjoyed like the critical thinking part, but just wanted a more direct way of helping people. And so that's what brought me into medicine and, being able to talk to patients and connect with them. So I'd anticipate maybe like having, 3 or 4 days a week of patient care and then having the remaining 1 or 2 days dedicated to research, mentorship.
And I guess that could always change too, because I know we've talked to other physicians on here that never envisioned themselves being in research and always wanted to do patient care, and then it kind of flip-flopped once they kind of got into the work and really found their niche.
Yeah. Oh, yeah, I'm really open to all the possibilities. Even within pediatric dermatology, like I know I enjoy vulvar dermatology, but I'm open to all the different subspecialties within.
Yeah. Let's touch a little bit on philanthropy, because I know Southwestern Medical Foundation, we support a lot of key initiatives that help support students and research. It connects community leaders to really the mission that's being done at UT Southwestern. So how do you view philanthropy, and why do you feel like it's a critical component to medical care and education?
Philanthropy is incredibly important. Without it, we wouldn't be able to advance patient care, advance research, or have funding for all of these amazing ideas that people have. I personally am very grateful. I received financial aid throughout my time in college at Penn. And so I think that it really evens the playing field for some people. And, we need more representation in medicine. And some of the people I would trust the most in my class to become, my future physician or my family's doctors come from, are the first in their family to attend medical school or even college. And I think they give a really unique perspective. And so I think philanthropy, to these populations is also really important. And within patient care, I think we all know, like, Parkland, these hospitals, the underserved hospitals, like philanthropy to those is just, I think, really evens the playing field and allows everyone to be the healthiest, best version of themselves.
So I wanted to shift gears a little bit. And one thing we often see on this show is some of the most memorable leaders, no matter what field they may be in, are not just smart, but they also are able to make those real human connections with patients and connections that last. Do you see yourself, when you think of yourself as a future leader, do you embody both the spirit of medical wisdom and human compassion that's needed to be a great physician?
I would hope so. I think, throughout my rotations so far, I've tried to do my best to make every person be seen as, a person, not just what they're coming in for. And I remember I was caring for a patient with cholangiocarcinoma who, was having a really rough time. It's a terminal illness. And so, I would do small things like, rubbing her back as she was like throwing up, or just bringing her like her charger or her like barf bags when she needed them. And on the very last day of our time together, she, started crying, and she said she thanks me for treating her like a person, not just a patient. And so I don't know. I think there's so much humanism in medicine, and sometimes when we're really busy, it's easy to forget that. But I think that's really important to remember, and I will do my best in my future as well to continue like uplifting others in that way.
How do you see yourself in the future kind of balancing that when your training is going to get, your workload is going to get more, your training is going to get more, you still have that patient to focus on. How are you going to balance that kind of approach as you move forward?
Yeah, I think setting aside time to, connect with each patient, even when you're busy, is really important. It's easier said than done, right, when we have a bunch of notes to write. But I think really sitting down, and it really helps patient care too, because when patients think that you care about them as a person, they're more likely to, open up to you and talk to you about things that they may not bring up otherwise. So I think even in the morning when you're checking in on a patient, just taking an extra 2 or 3 minutes even just to ask them about their lives or their daughters, their children and their families, and just to see how, who they are outside of this hospitalization, and that really helps, open each patient up.
As we prepared this conversation, one thing kept coming up again and again, and the idea of the future of medicine is shaped not only by accomplishment, but also by character. We see that a lot in you, and at UT Southwestern, there's a very special honor that recognizes one graduating student, not simply for their academic standing, but for embodying medical wisdom, human understanding, and compassion for the patients they serve. That honor is called the Hodin Award. What would it mean to you if you were to be honored with this award?
I think it'd be one of the greatest, honors to receive. I think that I remember the person who got it last year. I think she's just really embodying being a good person, not just intelligence or like being a good speaker, but just being a genuine person. And I think that's all we look for, whenever we're finding physicians ourselves, like someone who really cares about you as a person, not just, finishing up the visit, et cetera. And so I think it'd be a great honor.
Well, we invited you here to talk about being a future leader, which is true. But we held something back, and it is our great joy to tell you that you are the 2026 Hodin Award recipient this year.
Oh, wow. Thank you. That's such an honor. I just felt like goosebumps go down my arms.
Did you suspect anything?
No, like I feel bad because I actually told Dr. Barker I was not free the day he wanted me to come in. I said, sorry, I'm out of town. And he was very persistent. He said it was for a podcast. And so I actually recommended some friends who I thought embodied, leadership and humanism, and said, like, maybe you can ask these people. And he was very persistent. He was, so I was not expecting it.
That's awesome. So kind of what's your first initial reaction?
I think feeling very humbled, like, yes, I've received this honor, but it wouldn't have been possible without all of the examples that were set before me. I think both my parents are very humanistic people, and so I really look up to them, but also, all of the people who have helped me. I mentioned, the shuttle drivers and the maintenance workers, but, I think people who don't always get recognition are some of the most important people in our lives. And so really grateful to, Herb, Keisha, Daedrian, all of the shuttle drivers who take me to class every day, and all the maintenance workers who, fix my apartment when it needs to be fixed.
The award was established in 1943, the first academic year of Southwestern Medical College, the precursor to UT Southwestern. It has been bestowed upon students like you for the past 80 years, every year. It comes with a medal, a $20,000 scholarship, and the opportunity to address your fellow graduating students at commencement coming up in May.
That's really exciting.
Start writing your speech now. Who are the first people you think of? I mean, you mentioned a few.
I would say my parents, my husband, who, has been there every step of the way. We started dating in high school, and so he's watched me, shift from engineering into medicine, into pediatric dermatology, and he's someone who's always been there for me. And really, it's, I think, people in the community, the patients I care for. I know that, I have all these volunteering, experiences, but I think I've taken away more from each patient than they've taken away from me. So I'm really grateful to all of them as well.
How do you see this moment shaping you 5 years from now?
Yeah, I think it's a great reminder to continue doing what I'm doing at, higher and higher levels as I continue through residency and then fellowship and then finally becoming a full-fledged physician. Just continuing and maintaining, always remembering that, this is what brought me into medicine, and to continue living up to my values.
The committee chose you because of your character and your human connection. You demonstrated that here. So we have a few rapid fire questions. So this is take a little bit of the stress off here. No medical experience required. Just give us the first thing that comes to your mind.
Okay.
How do you reset after a challenging day at work?
I love to go on runs.
How long do you go?
3 miles is usually when I'm not a professional runner. I did a couch to 5K during COVID. I'd never really run before that. And so now I've found that 3.5 miles is my It's kind of my limit.
Yeah, me too. Favorite hobby outside of medical field?
I really enjoy playing board games with my friends and family. We'll host like game nights at our apartment, especially engine building board games, which is basically where you collect resources early on in the game and then that pays off later. So games like Azul, Catan.
Catan. I'm a big Catan.
Yeah, things like that. I love playing
that
board
one.
games.
Okay, next question might have the same answer. What are you overly competitive in?
I would actually say, yeah, board games. It's not too bad, but my husband and I, we've started, looking into cooperative games, like 2-player, like cooperative games like Sky Team, or there's a game called Fox in the Forest where you work together.
Okay.
So then like whenever we don't want to, have this competition, we just, do something fun together where we're on the same side.
All right. I like it. What's your go-to restaurant while you were a med student?
Ooh, so I cook a lot, but I would say probably King's Noodle. They're a Taiwanese restaurant in Richardson, and my family's Taiwanese, and so it's a nice, kind of a nice taste of home whenever I want it.
Nice. What's your favorite dish to cook?
Ooh, I would say there's this dish in Taiwan called 3-cup chicken. It's like a cup of soy sauce, a cup of sesame oil, a cup of like rice wine or rice vinegar. I don't put a cup in each because that would be a lot of liquid, but I love, putting a spin on it and doing like 3-cup seafood, 3-cup, you can cook 3-cup anything pretty much.
If you could instantly master one non-medical skill, what would it be?
I would love to be able to speak every single language in the world. I think it would just make it so much easier to connect with people, patients and non-patients. But having that skill and being able to travel anywhere in the world and knowing what the locals speak would be really valuable.
How will you celebrate your medical school graduation coming up next month?
I think just spending more time with friends and family, and my husband and I are actually hosting a wedding reception in May on our 8-year dating anniversary. So we'll have friends and family flying in from Taiwan, Ireland, where his family's from, and then all over the U.S. as well. And we'll be vacationing in Hawaii after that.
Sounds like fun. Okay, so what is one place you hope to explore in California once your residency begins at Stanford Healthcare?
Oh, I've already thought about this. All of the national parks. I would say there's 9, I think, in California. There's like Sequoia, Redwood, Death Valley. There's so many of them, and my family is like a national park family, so checking those off the list.
Okay, what TV show, book, or other form of entertainment helped get you through med school? What was your kind of escape for entertainment-wise?
Most recently, I read Project Hail Mary and then saw the movie that just came out. But I would say shows like Mad Men, The Bear, Halt and Catch Fire. Those are all shows that I watched with my husband throughout medical school, and they kept me sane.
I read Project Hail Mary. I haven't seen it yet, but it's on the
good.
list. Yeah.
It's really good.
It's been a special conversation, and we're honored to be able to be a part of this moment in your life. And we really appreciated you taking the time out and talking to us about being a leader in medicine. And we definitely hope there's more leaders like you coming down the pike at UT Southwestern. And I know there are. But once again, congratulations on your match and for being named the Hodin Award recipient.
Thank you.
We appreciate you joining us. Thank you to our listeners for joining us on this special episode. For those who want to learn more about the Hodin Award and our past recipients, we'll provide a link in the show notes. And with that, we'll see you next time on Learning from Leaders.
Thanks for listening to Learning from Leaders. If you enjoyed this episode, we invite you to subscribe now for monthly episode drops so that you can continue to learn from experienced business and community leaders to help you drive meaningful change in your community.